Hey guys, welcome back to another video. Today we're going to talk about 6 health issues that men face today. The reason I made this video is I think that we talk a lot about women's health, and women's health is very important, of course. They've got a lot of things going on, but oftentimes men's health gets forgotten about and neglected. So I really wanted to highlight 6 main health issues that men face today and how we can look at maybe preventing them and how we can hopefully prevent the effects of them. The first issue that I wanted to talk about is coronary artery disease. Coronary artery disease is so common amongst men. It is one of the most leading causes of death in British Columbia, and in fact, I believe it's so common in all of North America too. So what is coronary artery disease? So coronary artery disease is a buildup of plaque in the coronary arteries of the heart. So I'll show a picture here of the heart, and these are the arteries. And so what happens is, due to different reasons, there's buildup of plaque in the arteries. And what that means is it prevents your heart from getting blood and ultimately limits the function of the heart. So how do we prevent coronary artery disease from growing in our body? Well, the first thing you really want to do is have a really healthy diet. Diet is so important for preventing the growth of plaque in the arteries. It allows you to have better energy throughout the day, and it has so many health benefits. The second thing I want to mention is you want to have exercise. You want to exercise throughout the day. You want to exercise regularly, and this will prevent the buildup of plaque throughout your heart's arteries. It helps you in so many different ways, and I could just go on and on about it, but I'll stop it there. The third thing I want to mention is you want to have healthy habits. You want to try your best to quit smoking. I know it's easier said than done, but smoking can really cause a lot of health issues that goes beyond coronary artery disease. The second thing you want to be doing is you want to have low sodium foods. You want to reduce the amount of saturated fats, and you want to, the last one's very, very important, and the last one is reducing your stress levels. Figuring out how you can reduce your stress. Personally, I reduce my stress by exercising. Some people go to yoga. Some people go for walks along the beach. Whatever it may be, you got to figure out a way to cope with all the stress you may have in your life. The second thing I want to be talking about is hypertension. Hypertension is common in both men and women, and according to Health Canada, 1 in 5 Canadians suffer from hypertension. But what is hypertension? Hypertension essentially just means that you have elevated blood pressures, and when it gets really chronic, it can lead to many heart diseases. So what you want to do is you want to prevent yourself from getting hypertension by eating healthy. Having a healthy heart diet is so important, especially if you're genetically predisposed to having hypertension. How can you eat healthy? Well, you want to eat healthy by focusing on eating foods that protect your heart. So for example, fruits, vegetables. You want to have food that are really high in good fats, not bad fats. So omega-3s, fish, salmon, these are good examples of foods that have really good fats. And also you want to prevent yourself from having these very toxic foods for your whole body. So for example, constantly consuming sugary drinks can cause hypertension, if you consume them for long periods of time, of course. If you have 1 or 2 here and there, it's totally fine, but you want to protect your heart, and the way you do that is to not having these high fatty foods, deep fried foods. You don't want to have sugary drinks constantly. You want to reduce the sodium that you consume. Sodium is very huge. There's a high correlation between sodium and hypertension, so you want to reduce the amount of sodium that you consume on a regular basis. So the third health issue that I really want to talk about is colorectal cancer. Colorectal cancer is essentially cancer that forms in your intestines, in your bowels, and it is one of the most leading causes of death in men. So in order for you to be screened for colorectal cancer, there's what we call a FIT test and a fecal occult blood test. But essentially, you ask your doctor about it, and people who are more prone to having colorectal cancer are people who have had family members that have been diagnosed with colorectal cancer. So, if somebody in your family, if your grandmother, your grandfather has had colorectal cancer, you really want to talk to your parents about that, or ask questions about, hey, do you know anybody in the family who's had colorectal cancer? And if they have had it, you really want to get screened for it. And the way you get screened for it is by talking to your primary care provider, which is typically a family doctor, or sometimes can be a nurse practitioner. However, there are ways for you to prevent getting colorectal cancer, and this goes back to the first two health issues that I discussed. So you really want to prevent colorectal cancer by eating healthy. You want to be active, get exercise every day. And the third thing is you really want to limit your alcoholic intake. Have 2 or 3 beverages of alcohol maximum a day. And that will prevent you from having risk factors for eventually getting diagnosed with colorectal cancer. So Health Canada seems to believe that men ages 50 to 74 are more likely to get colorectal cancer, but I certainly think that it's worth having a conversation with your primary care provider, especially if you're genetically more predisposed to getting colorectal cancer. Being a nurse that works on an acute medical floor, I occasionally see patients that have colorectal cancer, and I can definitely say that there have been times where males have been unfortunately diagnosed with colorectal cancer who are less than the age of 30. And I remember I was helping out, I was providing care for a patient that was very young, and to this day it really, even thinking about it, just bothers me, because unfortunately he didn't make it. And that patient of mine, he was such a nice person, and he had so much hope in his life. And fortunately, if cancer progresses, if you don't speak to your family doctor early on, if you don't take initiatives, if you have a poor diet, if you smoke regularly, if you have a lot of stress in your life, if you consume a lot of alcohol, the effects of cancer can progress very, very fast, and it can consequently lead to terminal illness. And it's so it was so hard to see that patient suffer through that. And one of the main reasons I wanted to talk about this topic was because I want to prevent people to be in that situation. So the fourth health issue that I want to talk about is prostate cancer. So prostate cancer is essentially the abnormal growth of cells in a male's prostate gland. The prostate sits right below the bladder, and it's the part that makes semen for men. The prostate is usually the size of like a walnut, and as men age, the prostate gets bigger. Now, most cases of prostate cancer are diagnosed in men ages 65 and older. It usually grows slowly and can take years to grow large enough for you to realize you have issues, or you're having symptoms that may be caused by prostate cancer. So what are the symptoms of prostate cancer? Usually it's having to do with urination. So if you're having difficulty urinating, you're having pain, or if you're having difficulty having an erection, all these health issues may be caused by prostate cancer. So once again, you want to be proactive, right? If you're noticing some abnormalities, you should go see a primary care provider right away, either a family doctor or nurse practitioner right away, and so that you can really prevent it from growing. I remember in nursing school they taught us that this oncology nurse came and said, people typically, if they break their arm or if they break their leg, they go right away to the emergency to get it fixed. But usually with health symptoms, so symptoms of, for example, prostate cancer, colorectal cancer, people tend to, especially men, tend to tough it out because it's within our societal norms for men to be tough, and they're more willing to accept pain and suffer through different health issues. But they're more, and as a result, they're more likely to have diagnosis of cancer later in their lives. So if you seem to be having these symptoms that I mentioned for prostate cancer, what you want to really be doing is asking for a specific test. It's called the prostate specific antigen test, and you want to do that, and that will screen you for prostate cancer. So the fifth health issue that I really wanted to talk about was erectile dysfunction in men. So typically erectile dysfunction is pretty much as what it sounds. It's whenever you can't get an erection or you lose the ability to get an erection. Now, this is so common in men, and unfortunately not many men talk to their primary care provider once again about this. You may have prostate cancer if you have erectile dysfunction. So you really want to be speaking to your primary care provider about it. There's different reasons that people can get erectile dysfunction. Sometimes it could be just side effects of medication you're taking. It could be, even drinking alcohol and smoking have been linked to erectile dysfunction. High amounts of stress have been linked to having erectile dysfunction. And it's a health topic that men really don't talk about often, and it's not really talked about in society at all, but I definitely think it's worth mentioning here. And I think that most people are hesitant to bring it up with their primary care provider, but it's so important that you do, and you have the confidence and not to be shy, because this is what essentially I went to school for, and this is what essentially family doctors and nurse practitioners went to school for. They went to school to treat you for many of these illnesses. So the sixth health issue that I wanted to talk about is mental health. Specifically, I want to talk about depression and suicide. So depression affects millions of men every year, and it goes along with what I was mentioning before. A lot of men do not report their feeling symptoms of depression. So what are the symptoms? So the symptoms are lack of concentration, lack of appetite, loss of weight, difference in activity levels, you're just like a overall loss of energy, no motivation, lack of sleep is a huge one, so you can't really sleep well, you feel worthless or you feel guilty. Your one major symptom is you just have really bad mood, so like you feel really low and down all the time, or you feel very irritable all the time. These are common symptoms of depression, and if you experience any of them, you really want to be talking to your primary care provider about it. But once again, because men are more likely to tough it out, as they say, there are different ways that thankfully many people have created for you to screen yourself. So for example, there's a website here called headsupguys.org, which will be in the description box below. You can take a online screening test of depression, and it will tell you if you experience any of the symptoms and what you can do, and there's a lot of resources for men. I think it's also worth mentioning that if you know people that are suffering through depression, you really want to be there for them. Family and friends are the number one resource for a person suffering through depression, and what you really want to be doing is asking them about their feelings, connecting them with resources. So another great way to motivate a person with suffering from depression to go and speak to their primary care provider or seek therapy is just providing them with statistics, showing them through Health Canada or through different scholarly articles, through different news articles that, you know, depression affects a lot of men. It's not just them. And generally I found that me speaking to patients, as well as what I learned in school, they taught me, you know, telling them facts about depression is a great way for them to feel more comfortable with their illness. And the first step in getting better is always realizing that you have an illness, and that way you will seek out treatments for it. So there you guys go. Those are 6 of the most common health issues that men face today. I definitely want to mention that having a health issue, especially for men, is not a weakness. You know, a lot of people have health issues, and the earlier you're able to identify that you have a health issue, the faster you can get treatment for it and ultimately live a healthy life. If you like this video, please give it a thumbs up. Please consider subscribing. I'll have a new video every Sunday, and please let me know if you have any questions in the comments. I'll try and answer them. I tried to make this video very short. I couldn't provide too much information, so I hope you enjoyed it.